my name's Debbie, and I'm going to be doing a head, neck, and face assessment on Kendall today. And I want to, before I start, I'm going to get my hand hygiene, and I will be doing that, and then I'll provide privacy. I want to close the curtain or the door, wherever we're at. Hi, Kendall. How are you today?
Good, thank you.
How are you feeling today?
I'm good.
All right. So, as I'm talking to Kendall, I'm observing her appearance. I don't see any obvious deformities. Everything looks symmetrical in her limbs and her face. Her hygiene is good. She's well kempt. Her skin color is pink, and it doesn't have any lesions, obviously, that I see. Her posture is strong. She's sitting upright well. Her affect, she's pleasant. She's responding to my questions as I ask her. Her speech is clear when I ask, and her hearing, she's able to hear me in a normal tone of voice because she's responding as I ask her questions. And how is your nutritional status? Have you been eating well?
It's excellent. I eat a lot of fruits and vegetables, and I eat about 5 to 6 small meals a day at regular intervals with snacks.
Okay, awesome. So her nutritional status is good. Now we're going to move on to the head and face exam. And as I'm talking to her, she's making eye contact. So that's good. And then, Kendall, where are we at today?
We're in the LRC at the Mercy College of Nursing and Health Sciences.
Okay, and can you tell me your name and your date of birth?
And my name is Kendall Dishman, and my date of birth is June 5th of 1981, and that makes me 34.
All right, and what day is it today?
Today's Thursday.
And what day of the month?
It's the 5th of November, 2015.
So Kendall is oriented times 3. Now we're going to move on to the inspect and palpate the scalp, and I'm going to be observing the hair. The hair is clean, and so I'm going to go ahead and observe your scalp now. And I'm going to be touching you, and we're going to feel for any masses. Are you having any pain as I touch your scalp?
No.
Okay. And then I want to also assess the temporal arteries. I'm going to feel for that, and it feels strong on both sides. And then I also want to come down and assess the temporal mandibular joint, and no abnormalities with that either. So now we're going to move on to the confrontation with the eyes. And so I'm going to give you a piece of paper, and then I'm going to have you cover, we will be covering that eye. And then I'm going to be moving my fingers inward, and I want you to tell me if you can, once you can see them.
No. No.
Okay. And then we'll switch eyes.
Okay. No. No.
Okay. And so her confrontation is good. She's able to see me peripheral-wise vision. Now I'm going to go ahead and be assessing her actual eye itself. I want to assess the corneal to the light reflex. So we're going to get the otoscope out. I'm just going to have you look straight at me, and I'm going to be shining light in your eyes, okay? So that pupil is reactive to the light. And I'm going to do this pupil. And it's reactive. And I'm going to go back to the other side to make sure that this pupil on this side reacts as this one does with this side. And you have equal reaction. Now we want to do, we're going to do our sixth hard test with the peripheral, just the gaze. That's what that is, right?
Mm-hmm.
Okay. So I'm going to be moving my fingers around, and I'm going to have you watch my fingers as I move it, okay? I'm just going to follow my finger as I move it. And then follow down this. Okay, and then we'll do this side over here. Okay. And so her gaze is good. She's able to follow my finger equally when I do that. Let's see. So then I want to be inspecting the actual eye itself. I'm inspecting the external structures, and I don't see that she has any abnormalities. Her eyes aren't shrunken in. And then I want to go ahead and observe the conjunctiva. And so we're going to pull your eyes just a little bit, and supposed to be. Her cornea, they're both, um, they're smooth. And then her irises, they're 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 the same color. They're green, and they're equal in size, as well as her pupils. They're about equal. They're about a 2, I would say. And she is able to react to Perlis, so she's positive for that, as I've been doing that. And if we had a Snellen chart, we would also assess her vision distance. We would place her about 20 feet from the Snellen chart, and there's a big letter E, but they also have other letters on it. And then we would have her, they start big letter, slowly getting smaller, and we would have her read the biggest line and then slowly towards the smallest line, so we could see her vision. And we do this on both sides of the eye. Alright, so now we're going to move on to the maxillofacial and then the frontal sinuses. I'm going to be observing those. So we kind of just palpate a little bit in here for the maxillofacialism and the frontal here. And I don't feel any abnormalities there. And now from there I'm going to go ahead and inspect her ears. So we need our otoscope again. I'm going to pull back on your ear just a little bit to make sure that I'm looking at it. I want to observe the tympanic membrane and make sure that it's white. And I'm also looking for lesions, redness. And do you feel any pain when I do that in this ear?
No.
Okay, so in that case, we would know that we don't really need to further examine that, possible for an ear infection. So I'm going to move to this side and make sure that I see about the same thing. One side is equal to the other. Did you have any pain in this ear?
No, I do not. Thank you.
Okay, good. Alright, so next we will move on to the whisper test. So I'm going to have you kind of push in or cover this one ear, and then I'm going to say a 2-syllable word and have you repeat it if you can hear me.
Excellent. Baseball.
Alright. And now we're going to this side. And
Bathroom.
alright, good. So she can hear the whisper test on both sides. So that's intact. Now we're going to move on to her nose.
Okay.
And I'm inspecting for the symmetry of it. Outside, externally, it's equal. And now I'm going to use my otoscope again, and I'm going to pull up on the nose just a little bit, and I want to observe. It's a pink color, it's moist, and the septum does not look like it's deviated, so that's good. And I also want to be inspected to turbinate, as I'm in there as well. Okay, so now we're going to move on to the mouth and the throat. And I want to be inspecting just kind of the neck area around the mouth. I don't see any lesions outside of the mouth. And I'm going to ask her if she can open her mouth for me. And I'm going to look in your mouth and look at your teeth. Do you have any sores in your mouth right now?
Not that I'm aware of.
I'm going to put some gloves on, and I'm going to kind of just assess your oral cavity, the mucosa. And can I have you smile for me real big? Okay, good. And the Kendall's teeth are all intact, and they look like they're well cared for. They're fairly white. Turn my otoscope back on. And I'm going to pull down on the mouth and look at the gums. And it looks pink and moist. I'm going to do a little bit of ear, still pink and moist. And then I'm going to actually feel in your mouth just a little bit to feel for any nodules and that kind of it. So if you open your mouth for me. Any sores that are feeling there?
No, ma'am.
Now I'm going to assess the tongue, and then we'll assess the tongue as well. So I'm going to have you open your mouth one more time, and I'm going to assess the roof of your mouth. Okay, so it's just a little bit white color. It's pink and it's moist. And then I'll have you stick out your tongue and say "ah" for me. Okay. And then kind of actually stick your tongue out for me. Okay. So I see her uvula is moving up and down. The condition of it is intact. She's able to move it. Her tonsils have been removed. And her gag reflex, when she says "ah," that shows me her gag reflex, so that's accessing cranial nerve 9 and 10. And then when I had her stick out her tongue, that was 12. Cranial nerve 12. Right. So now we're going to do the neck inspection. And I'm going to start by just coming in front of her, and I want to inspect her neck, look for any abnormalities that I might see before I start actually palpating. I don't see any masses. I don't see any jugular vein distension or pulsation. So now I'm going to go ahead and move on, and I'll assess the lymph nodes. So we have the post-auricular, right before the ear, or the pre-auricular, and the post-auricular behind the ear. And then we're going to start coming down the supramandibular joint, and then we'll kind of move up to the mental, which is the chin. And then I also have, we're going to do the anterior cervical, and that is right up here. And then the posterior cervical is that kind of behind the neck. And then we have the supraclavicular, which is above the clavicle. I want to palpate there. And then the infraclavicular. And then we also have the occipital, which is right back in the occipital bone. I can't talk. Okay. And then the posterior cervical we did back here. And then we also have the deep cervical that I need to do. So I'm going to have you turn your head. And you usually can't feel these. And we'll also palpate over here, and I don't feel lymph nodes on either side. And they are pea-sized, and they're pea-sized or larger, and they are mobile, and they're soft. Did you have any pain when I was palpating?
No, I didn't. Thank you for asking.
Alright, so the neck, I still need to palpate the carotid pulse, so I'm going to go ahead and do that. It's strong on both sides. And then we are going to do the trachea, assess that area. Her trachea looks like it's midline. And then I want to do the thyroid. I want to assess that. So I'm going to have you turn just a little bit that way, and kind of around the back side of you.
Oh, okay.
And then I'm going to have you swallow. And then I want to, this is not necessarily real comfortable, but I'm going to put a little bit of pressure here.
Okay.
And then you're feeling for any goiter, any abnormalities, pain when I do that. And then I also want to have you check your range of motion of your neck.
Okay.
So I'm going to have you bring this chin over here and kind of touch your shoulder.
Okay.
Okay. And then we'll go over here.
Okay.
And then I'll have you come down and touch your neck.
Okay.
All right. And then we want to check the strength of the neck. So I'm going to have you try to push your face this way just a little bit.
Okay.
And then the other side.
Okay.
All right. So her strength is strong, and it's strong for her age. She doesn't have any weakness when we're doing that. And this concludes the head, neck, and face exam.